Ready to begin, Chairman.
Thank you, Anisha. Would you call the roll, please?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker. Cynthia Rucker. Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley. Is that you, Mr. Mobley? Shane Mobley. Robert Cowles,
Here.
and I'll go back over the individuals that did not provide a response. Shane Mobley. I heard something mutter, but I don't know if it was someone's mic or not. Mr. Mobley, are you?
This is Dr. Cowles. That was my microphone coming on.
Thank you, Dr. Cowles. Last call, Cynthia Rucker. Chairman, that concludes my roll call.
Okay, thank you, Tanisha. You'll welcome to all of you, and thank you for taking your time this morning at a little different timing than our normal meetings, being a Friday other than a Thursday. And you'll notice that we have new digs here this morning. We're in the room here on the 34th floor. Our boardroom was the casualty of a freezing sprinkler system, I think, over the Christmas holidays, which has not been unusual in our areas. We've all experienced some very cold weather over the Christmas holidays. So thank you all for being here this morning, and bear with us if we have any technical difficulties, but we'll try to make all of this work as it normally does. So I believe we have a quorum to conduct business today, and so we will proceed. I'll maybe skip, since Dr. Rucker may be joining us a little bit later, I'll skip over the first item of agenda related to previous month's meeting and move directly to the comments from our commissioners.
Good morning. Thank you, Mr. Chairman. And thank you for your flexibility and the flexibility and the cooperation of the board, again, for accommodating both our technology and location setup today, as well as the date change, as we're pleased and proud to support the governor and all the constitutional officers in their swearing in activities yesterday. Few updates for you today across a variety of topics. The legislative session has started. We're pleased to see the creation of two new committees, one in the Senate, one in the House, and we look forward to working with those new committee chairs on any potential health topics that touch DCH this session. We have one piece of agency legislation that we'll pursue from HFR, but it's fairly minor, but otherwise we're going to be engaged and ready to assist our policymakers with initiatives that they bring forward. In terms of our CMO procurement, we have issued the first, or the second step after we did the RFI over the summer. On January the 3rd, the department issued an RFQC, or a request for qualified contractors. That will be open for several weeks. And after that concludes, it's essentially the precursor to the RFP, where we will pre-qualify suppliers as potential bidders for the forthcoming RFP later this spring. So we'll keep you updated on that progression. We have talked a number of times about how the state health benefit plan has been engaged with the Department of Audits and Accounts on a special performance review or financial audit of the SHBP plan. We have seen a draft report of their work and can't thank them enough for their time, energy, and effort for putting that together. I believe that will be issued in a final form really any day now, and we'll be make sure that you guys all see a copy of that. On that same topic, our joint budget hearings start on Tuesday, and I'll be presenting 3 separate times on Tuesday. And the first will be specifically related to SHBP and OPEB and our long-term liabilities on our OPEB accounts. What you'll see and what we've talked about is that as healthcare expenses and our plan expenses, have grown over the years, premiums and revenues have stayed fairly flat. And I think that's something that Department of Audit's report will highlight. But what you'll also see, the governor's budget was officially released this morning, is that there is a lot of support by the governor and his team in the budget for the state health benefit plan. While we'll be working on plan design and upcoming reprocurement in SHPP over the next year and a half, we'll see close to $1 billion invested in the governor's budget recommendation directly into SHPP. So we're very thankful and appreciative for him and his team and their leadership on that effort. And we'll certainly be having more conversations about that. Updates on the federal public health emergency. It is not ending. It has been extended to April 11th, I believe. But the Consolidated Appropriations Act that was passed congressionally in December included a new provision related to the continuous enrollment requirement for Medicaid, which essentially during all of the public health emergency, Medicaid agencies were not allowed to disenroll any Medicaid members or redetermine their eligibility. They have decoupled that provision from the continuation of the public health emergency. So while the public health emergency will continue, that requirement that no one's eligibility be redetermined ends on March 30th. So we're working very closely with the Department of Human Services and DFACS to prepare for that and our team. What that means in practice is that beginning in April, we will start to redetermine Medicaid members' eligibility for the first time in several years. And that will be a process that continues for about 12 to 14 months. And so we'll see a lot of fluctuation in our membership. That'll be a lot of communications. You'll start to see more in the media and a full court kind of communications press that the Department of Human Services is leading in that regard. So we'll keep you updated on that. At the same time, we're also moving forward with our 1115 demonstration waiver, our Pathways project, which is our limited Medicaid expansion program. We are in fact, we held a new kickoff with about 90 business partners on Wednesday. We are targeting a very aggressive timeline to have that in place by July 1st. We're working very closely with CMS and our federal partners to ensure that we move that to successful implementation, and we appreciate their support and the support of all of our sister agencies and vendors across the state that are helping to do that. A couple of staff announcements. I want to welcome Dr. Dean Burke, former senator, who has joined us in the Medicaid division as the Medicaid Chief Medical Officer. He'll be working specifically on Medicaid quality and quality reporting, be intimately involved with our CMOs and how we move forward some of our key healthcare initiatives there. And we're very grateful that he joined us. And then a couple of milestones for our employees that they hit in December. Annette Delano, Jocelyn Hart, and Dwayne Carter all celebrated 5 years with the department and couldn't be prouder of their service to the state and to the department. Mr. Chairman, I'm happy to take any questions, but otherwise that concludes my report.
Thank you. Any questions, comments from the board, please? I have one question on this reevaluation of eligibility under Medicaid. What is that required? Does that require participants to reapply?
It well, in some cases, yes, and in some cases, no. So the state the best way for us to do it is what's called an ex parte renewal, where we use data sources that are already at our disposal, other sources of information around the state to automatically assess someone's eligibility and redetermine that without having to have a lot of contact with the individual. For those that we don't have that information for, it will absolutely require them to resubmit some information. And so one of the biggest things that we're stressing to our Medicaid members right now is to make sure we know how to reach them, to keep their information, their contact information updated. There will be a lot of reporting required with CMS regarding this effort that we'll work jointly with DFACS to make sure that we get submitted timely and hit those metrics. But that's 2.7 million Medicaid members that will all have their eligibility redetermined over the next year.
Very good. Any other questions, comments from the board, please? Thank you very much, Commissioner. That will, Dr. Rucker still not on the call, please.
She just sent me a message, Chairman. She said that she is muted and unable to be muted,
Okay.
but I don't see her. So I asked if she had called in via a landline. So maybe if we can circle back to that item.
All right, we'll circle back to that. Moving into our agenda today, we're being asked to consider 5 different areas for consideration, and we'll vote for initial adoption. Be asked to approve initial adoption or not. And Joe Hood, our Chief Operating Officer, will make the presentation on all 5. And so, Joe, it's your show today, so lead us through it.
Thank you so much. Good morning, Mr. Chairman, Commissioner, and board members. Today, the department is bringing forth rule changes to Section 111-8-40 for notice requirements for hospitals for initial adoption. This is an amendment to an existing rule to require hospitals to provide the Department of Community Health 180 days prior written notice of specified changes materially affecting organized services offered by the hospital, subject to monetary penalties for late notice. The department will review such proposed changes within its regulatory authority. The amendment further specifies that hospitals must provide the Department of Community Health 180 days prior written notice of anticipated closures, which is an increase from 30 days notice, and revise hospital responsibilities prior to closure, subject to monetary penalties for late notice. The amendment also clarifies that a new hospital permit is required upon merger with another hospital. Additionally, the amendment clarifies that a facility that is seeking to terminate its enrollment as a provider of medical assistance shall submit a written request to the department documenting good cause for termination as may be applicable in accordance with the Official Code of Georgia 31-6-45.2. There will be an opportunity for public comment at a Zoom meeting for a public hearing that will be held on January 18th at 11 a.m. Additionally, the department will accept written comments through January 27th, 2023. Mr. Chairman, I'm happy to answer any questions from the board in regard to this request for initial adoption. However, if there are none, I would ask for favorable consideration.
Or questions or comments from the board, please? One comment, just clarification, Joe. I think behind the reasoning of all this, as an example, if a hospital facility is closing, having a longer transition period, being everybody knows it's a transition, it helps to facilitate that transition and make sure that the clients or patients or whatever of that hospital have a more of a chance of being consolidated into other areas. Is that partially the reasoning for this change?
Absolutely. As some may be aware, we've had a recent hospital closure, and we certainly would see a benefit of where we would have adequate time, not only for notice to the patients, but notice to other providers that surround that hospital to accommodate perhaps an increase in different lines of service that are there. And that has given us cause to review our administrative rules and look to see where we could have a more transparent process when that's occurring, not only for a closure, but as I referenced, for major lines of service. So if you were to close, for example, outpatient services for a particular line of service at a hospital, it's important to understand both from surrounding hospitals who will have to absorb that availability and to the patients, as you referenced. And additionally, also notice that we know where patient records are and that those are adequately accounted for and provided for in a transition to a new provider.
Thank you. I would assume also that's would be a benefit to the employees.
Absolutely.
Okay. Any other questions, comments from the board, please? If not, is there a motion for approval for initial adoption?
Motion to
Folsom.
approve.
Folsom second.
Yeah, Roger Folsom has seconded. I didn't catch who had made the initial proposal.
Motion to approve, David Cruz.
David Cruz made the motion for approval and Roger Folsom has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Joe, for initial adoption, and we'll see what the input is when we come back and discuss it for final.
Thank you, Mr. Chairman.
You may move ahead to your next item, please.
Thank you, sir. The next item that the department is bringing forth is in reference to nursing home rules and regulations. Today, the department is bringing forth recommended changes in the nursing home rules and regulations contained in 111-8-56 to incorporate new notice requirements to the department for initial adoption. This is an amendment to an existing rule, updating nursing home permit requirements. The amendment requires that applicable parties of nursing homes provide at least 90 days prior written notice of a proposed transfer of ownership or operator, anticipated closure or interruptions of operations, certain nursing home transactions, and material changes of nursing home operations. The amendment sets forth penalties for failure to provide such notice. Additionally, the amendment specifies explicitly when the nursing home permit must be surrendered to the department. There will be opportunity for public comment at a Zoom meeting for public hearing on the proposed changes on February 1st, 2023 at 11 a.m. Additionally, written comments will be accepted by the department through February 8th of 2023. Mr. Chairman, I'm happy to answer any questions from the board in regard to this proposal for initial adoption. However, if there are none, we request favorable consideration. Thank you, sir.
Questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion for approval, Cynthia Rucker.
Well, Dr. Rucker, thank you for joining us.
Thank
Is
you.
there a second?
Second, Dr. Lee.
There is a second by Dr. Lee. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, thank you very much. You may move ahead.
Thank you, Mr. Chairman. Our next item that the department is bringing forth today is a petition for rule changes or the establishment of new rules, an administrative rule in that regard. The department is bringing forth a new rule in 111-1-1 for initial adoption to establish a formal administrative procedure for review and consideration of a petition for promulgation, amendment, or repeal of administrative rules made by an interested person pursuant to the Official Code of Georgia 50-13-19. There will be an opportunity for public comment at a Zoom meeting for a public hearing on the proposed rule on February 8th at 11 a.m. Additionally, written comments will be received by the department through February 15th, 2023. This is a formal process. There's already a provision for the department to accept consideration for these revised or a new rule to be established. This is formally putting forth an administrative process to conduct that business. I'm happy to answer any questions in regards to this initial adoption, but if there are none, Mr. Chairman, we'd ask for a favorable consideration.
Questions, comments? Hearing none, is there a motion for approval for initial adoption?
Motion for initial adoption, Folsom.
Roger Folsom has made the proposal for initial adoption. Is there a second?
Second, David Cruz.
David Cruz has seconded that. All in favor, say aye.
Aye. Aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved for initial adoption. Joe, you may proceed.
Thank you, Mr. Chairman. Our next item is an amendment to facility organization and administrative requirements for end-stage renal disease facilities or dialysis facilities contained in 111-8-22 for initial adoption. The department is bringing forth a rule change for initial adoption to section 111-8-22. The amendment or the rule will change the nursing required ratio from a requirement of one nurse to every 10 patients to a requirement of one nurse to every 12 patients. For some background, during the pandemic, this ratio has been in place at what is initially proposed here throughout the pandemic without concern to the department's knowledge. And there has been a request to the department to permanently expand this ratio, and seeing no reason at this point not to, we're bringing forth this initial adoption to expand that ratio to continue what has been the practice within the pandemic and have one nurse at dialysis clinics for every 12 patients on a permanent basis. There will be an opportunity for public comment in a Zoom meeting for public hearing on February 15th at 11 a.m. Additionally, written comments will be received by the department through February 22nd, 2023. I'm happy to answer any questions in regards to this proposal, Mr. Chairman, but if there are none, we request favorable consideration of this initial adoption.
Any questions, comments? Just curious, Joe, you said we request to make this ratio permanent. Now, obviously, it's been in place anyway, but just out of curiosity, where the request?
It's a request from a number of providers through their association to make it permanent.
Okay.
Yes, sir.
That's what I wanted to know.
It's coming from the industry. Yes, sir.
Yeah. Any other questions, comments? Hearing none, is there a motion for approval for initial adoption?
It's Dr. Cowles, so moved.
Dr. Cowles has made a move for initial adoption approval. Is there a second?
Second, Williamson.
It has, Anthony Williams has seconded. We now have the motion for seconded and for adoption. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, if you may proceed.
Thank you, Mr. Chairman. Our last item is a repeal of an existing administrative rule. The department is requesting an additional adoption of the repeal of a rule in its entirety for the Department of Community Health Planning patients' right to independent review that is contained in section 111-2-3. The proposed rule is requested to be repealed due to the passage of House Bill 1013 in 2022, which transferred the oversight of these provisions from the Department of Community Health to the Office of the Commission of Insurance and Fire Safety, effective July 1st, 2022. There will be an opportunity for public comment in a Zoom meeting for public hearing for this proposed change on January 25th at 11 a.m. Additionally, the department will receive written comments through February 1st of 2023. I'm happy to answer any questions in this regard, Mr. Chairman, to this rule proposed repeal, but if there are none, we'd ask favorable consideration of the initial adoption.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion, Roger Folsom.
Roger Folsom has made the motion for initial adoption. Is there a second?
Second, David
Cynthia
Cruz.
Rucker, second.
David Cruz has seconded that. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Joe, and thank you very much.
Thank you, sir.
Presentation this morning. I want to thank the department again for Joe and his staff and the people that prepare the materials. We run through these fairly rapidly today, but there's a lot of work goes on behind the scenes. And as a board, we certainly appreciate having this information ahead of time. We've all had the proposals so they can be reviewed in advance, and we appreciate that as usual. Let's circle back. Dr. Rucker's now on the call, I believe, and out of a meeting. We on the minutes from the October 13 meeting. Have you had a chance, Dr. Rucker, to review those, and can you recommend approval?
Yes, sir. Good morning, Chairman, and my apologies for all the technical difficulties, but I have reviewed the minutes from October 13th, and I found them to be in order, and I do recommend they be approved as stand.
Thank you very much. Is there a second?
I second Dr. Lee.
Dr. Lee has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. And thank you very much, Dr. Rucker, and apologize for technical difficulties we may have here as in this new surroundings for us today to conduct our meeting. Does anyone know of any new business that needs to come before the board at this time? Hearing none, I would like to close the meeting today, and I think it's appropriate that we remember the late Commissioner Clyde Reese in his untimely passing. Commissioner Reese served this board and department as a boss, as a friend, and as a person that was very dedicated to supporting the mission, which is a healthy Georgia. He felt very deeply about that, and I enjoyed working with it, as many of us had that opportunity. With that, we'll close our meeting. Our next meeting will be February 9th. Thank you very much, and Happy New Year to everyone, and have a good day. Goodbye.
Thank you.
Thank you.